Hafaday, welcome to the FY21 Government of Guam Open Enrollment. My name is Hassan Kraybani. Aetna and myself are very excited to continue to support you, your families, and the Government of Guam into the next plan year. I wish I could be there with you today. However, keeping in mind the current pandemic, your health and safety is of utmost importance. Throughout this presentation, I'll be providing key updates, which plans are available to you, how to use your plans, and other Aetna resources available. Open enrollment is September 10th through September 25th. As a result of the pandemic and PCOR 1 status, our office is closed to the public. However, our team is ready to assist you by phone, so please reach us at 47 Aetna. Beginning open enrollment September 10th, our office hours will be Monday through Saturday, 8 a.m. to 5 p.m., and on the last day of open enrollment, September 25th, Friday, our office hours will be 8 a.m. to 8 p.m. Some other key updates include changes to pharmacy, which we'll be sharing later, but on a high level, the formulary effective October 1st, 2020, our formulary will be changing from Value Plus to Advanced Control. There will also be changes to the mail order drug benefit. So if you're currently taking a drug prescription, please be sure to review this section of your brochure very closely. During open enrollment, this is the time to make changes, whether it's changing your plans or adding or removing dependents or terminating coverage. If you don't make the changes now, you may have to wait until open enrollment next year, unless you have a special qualifying event throughout the middle of the year. If you're not making any changes at all, there is no need to complete an enrollment form or change form. Everything will roll over. Your current existing elections and any enrolled dependents will roll over into the next plan year. With our ID cards, there is no need to receive a new ID card if you're not making any changes. Your current ID card that you have on hand will still be the same, and you can continue to use it. If you are making changes to your plans, whether maybe you're moving from the PPO to HSA, or you're enrolling and adding dependents, that may trigger a new ID card to come to your address. However, the ID number on that card will not change. So that'll allow you to continue to use that ID card into the new plan year without any disruption. And if you are making changes, please be sure to complete that enrollment change form during September 10th through September 25th, and to submit that form to your agency or department. You can submit it, please follow the directive provided by your agency, but some options include mail, drop-off, email. So please be sure to check with your agency on the preferred method for your submission. Key plans available to you include the PPO 1500, the HSA 2000, and the Retiree Supplemental plan. These medical plans have certain criteria for eligibility. Those eligible for the PPO 1500 and the HSA 2000 include full-time active employees and also retirees or survivors who are not enrolled in Medicare A and B primary. The Retiree Supplemental plan is for those who are retirees or survivors Medicare A and B primary. If you qualify for the RSP, if you are Medicare A and B primary, you must enroll in the RSP plan. And if you enroll in the RSP plan and you have eligible dependents, maybe it's a spouse or domestic partner or legal guardian children or biological children or adopted children that fall within the criteria of dependent eligibility, as you can review in your brochure, those dependents who are not Medicare A and B primary may enroll in the PPO 1500 or HSA plan. And then dental is available to all subscribers. Each of our plans provides you with access to over 650 providers in Guam, over 1.3 million providers coast to coast, U.S. mainland, and also over 165,000 international providers. To review your PPO 1500 HSA plans, again, you must be a full-time active employee of the government of Guam or a retiree survivor of the government of Guam not enrolled in Medicare A and B primary. Each of these plans have a deductible, but what's different between the two plans is the HSA 2000 is a qualified plan to manage a health savings account. These include rules and regulations determined by the IRS for what is a qualified health plan to have a health savings account. A health savings account is a separate bank account which you put money into that is tax deferred. And that bank account is managed by another third party, such as ASC or any others that are available to you. So please be sure to check out those options. The PPO 1500 has a $1,500 deductible for an individual and $3,000 deductible for a family. Using myself for example, myself, my wife, my 3 kids, we would be enrolled in the PPO 1500 with a $3,000 deductible. If I'm the only one using the health plan, then I only have to satisfy up to no greater than my individual member deductible of $1,500. The PPO 1500 also has an out-of-pocket maximum of $3,000 for an individual and $9,000 for a family. So similar logic applies. Again, if I'm the only one in my family using the health plan, the $3,000 out-of-pocket maximum is the amount that I would satisfy. Once I satisfy my deductible and my out-of-pocket maximum, the plan will begin to pay 100% for me. If my wife and my kids start to use the program, maybe they use it less than I do, or less frequent, or less volume, they will then share the remaining deductible left of the plan, and then they would each be then responsible for their own individual out-of-pocket maximum, but collectively as a family no greater than $9,000. The lifetime maximum is unlimited. Preventive care is covered at 100%. So please, we want to encourage everyone to get their routine physical exams, their age, gender recommended screenings. Each of those are covered at 100%, no cost share to you. Physician office visits and outpatient lab and x-ray under the PPO 1500 is $20 copay. Specialist office visits and chiropractic care is a $40 copay. Emergency room is deductible than 20%. Urgent care is $50 copay. Inpatient hospital, subject to a semi-private room limit, is deductible than 20%. Outpatient hospital and complex imaging, CT, MRI, PET scans, is deductible than 20%. These are the amounts that is your responsibility. So in these instances where I say deductible than 20%, what that means is your responsibility for those benefits which the deductible applies is the deductible, at which point when you have satisfied the deductible, your responsibility will be 20% of the remaining eligible charges. Aetna will pay 80% after you have satisfied your deductible in those instances. The HSA I mentioned works a little bit different. The deductible applies all the way down, right, to include most medical services, excluding preventive care, and also pharmacy, which we'll talk more about later. Within the HSA program, using my example of me and my family enrolled, our family deductible would be $4,000. In the event that I'm the only one using the health plan, let's say if I'm the only one using the health plan, my individual deductible cap is $2,800. It's not $2,000 like the individual. The IRS has certain guidelines that say within a family under an HSA qualified plan, the individual deductible cannot be less than $2,800 for the upcoming year. So when I have satisfied my individual cap, if I'm the only one using it, or maybe collectively as a family we're all using it and no one hits $2,800 but we all share $4,000, once we've satisfied the deductible, then the plan benefits will start to kick in. The out-of-pocket maximum follows similar logic of the individual amount. So In my example of me using the health plan, and I've satisfied $2,800 individual member cap under a family HSA plan, that $2,800 is going to bring down my out-of-pocket maximum. So collectively as a family, it's $12,000 out-of-pocket maximum, but each of us have an individual out-of-pocket maximum of $4,000. My $2,800 deductible is going to bring down my out-of-pocket maximum. Then as a member, I would be paying my co-insurance or copay, which also apply to the out-of-pocket maximum. So once I've satisfied my deductible, as you'll see within the brochure, physician office visits and outpatient lab and x-ray, deductible, then $20 copay. Specialist office visit and chiropractic care, deductible, then $40 copay. So now I've satisfied my deductible. Now I'm just paying copays since I've satisfied it already. Emergency room, deductible, then 20%. Urgent care, deductible, then $50 copay. Inpatient hospital, deductible, then 20%. Outpatient hospital and complex imaging, deductible, then 20%. The deductible must be satisfied before the plan will begin to pay. And again, as a reminder, the amounts that I'm sharing are the member responsibility. So again, deductible, then 20% means that you've satisfied your deductible, then the remaining balance thereafter, whether it's the same bill or next services, is 20%. Aetna pays 80% of eligible charges. Both the PPO and the HSA plans include coverage for routine eye exams at 100%, and also vision care supplies, such as your frames and contacts and lenses, up to $150. The plan will cover up to $150 for those supplies. Anything above $150 is the responsibility of the member. Both plans also provide coverage out of network. While I won't go through line by line, provided to you is a summary of each of the out of network coverages. However, please note for each of the two plans out of network, there are different deductible amounts, there are different out-of-pocket maximums, and then for services in general, it is deductible, then 30% for PPO 1500, and for the HSA 2000, deductible, then 50%. When you go out of network, we do not have a contract with those providers, so we have no control over the amount that they choose to bill you. What that means is when you go out of network, we're going to pay, after you've satisfied your deductible out of network for each of the respective plans, when you've satisfied your deductible, we're going to pay our co-insurance, let's say our share of the PPO 1500 deductible, then 70%. Aetna's going to pay 70% of the up to the allowed amount. Providers may bill you over the allowed amount, and that's called balance billing. That amount Aetna has no control over. So please be sure to make sure that your providers are participating with Aetna. Myself, anytime I go to the doctor, I always verify every time I go because things change frequent. Do you still participate with Aetna? Are you still contracted with Aetna, with my plan? This is very important so that we want to make sure that you have a great experience through your health journey. Now we'll be reviewing the Retiree Supplemental Plan, RSP. This plan is available to Medicare to retirees and survivors who are Medicare A and B primary. The way this plan works is, for services that are covered by Medicare must be received at a Medicare participating provider. Services that are not covered by Medicare but covered by Aetna are to be received at an Aetna participating provider. If you visit an out-of-network provider for services, it will not be covered. So if you go for a service that's covered by Aetna, not by Medicare, and you go to a non-Aetna provider, the plan will not cover those services. And again, I mentioned earlier, for your dependents who are eligible dependents under the plan, who are not Medicare A and B primary, they may enroll. in the PPO 1500 or the HSA 2000 plan. If you have multiple dependents who are not Medicare A and B enrolled primary, you cannot split them between two different plans of the PPO or the HSA. You have to pick one for, so all, using myself as an example, my kids, let's say I enroll them all in the PPO or all in the HSA, but I can't split my kids into the two different plans. Also, for additional services provided by Aetna, we have Medicare Direct. Medicare Direct is a program within Aetna that you have to sign up for that links Medicare to your Aetna ID. And what happens is, let's say you go for a service to a Medicare participating provider covered by Medicare. That provider is going to submit the claim to Medicare. Medicare is going to process that claim, and then they're automatically going to push it to Aetna for secondary processing. What that does is it takes you out of the administrative burden of managing your plan. And what it does is it simplifies the process, not just for you, but also for the provider. It makes so that you don't have to sit there and wait for your Medicare EOB to come to then submit a claim to Aetna. It's all streamlined. We have enrolled many retirees already into Medicare Direct. If you're currently waiting for your Medicare EOB to submit a claim to Aetna, please, please, please call our member service team to advise them that you want to enroll in Medicare Direct. The Retiree Supplemental Plan, as I mentioned, when you go for those Medicare covered services to a Medicare participating provider, oftentimes Medicare may have a deductible, but the way that our plans work is any amount that comes over from the Medicare EOB, from that claim that's been received, to include deductible, the plan pays 100%. Aetna pays 100% to include deductible. For any service that is not covered by Medicare and you visit an Aetna participating provider, those services will be covered by Aetna. The plan pays 80%. Pharmacy. Each of the plans cover pharmacy. However, a few updates, as I mentioned earlier, to include the following changes. Effective October 1, the formulary will be changing from Value Plus to Advanced Control. You can view the formulary on Aetna.com's website, and you can type in your drug that you're taking to see how it's covered if there's any change. Another change that's taking place is mail order drug. So our tiering, Aetna's tiering is called, within Advanced Control, we have preferred generic, and then we have preferred brand, and then we have non-preferred generic and non-preferred brand. That's the third tier. What's changing with mail order drug is the second and third tier pharmacy mail order drug benefit. So preferred generic will remain no charge, but preferred brand and non-preferred drugs will now have a copay, and we'll review those here. I provided a listing side by side of each of the plans. But first, the ACA preventive drug list, the Affordable Care Act preventive drug list. This is a specific list that's been determined by the ACA, or healthcare reform. You can view that list online at Aetna.com or also at the Aetna Gov Guam website. With a prescription for all plans, these drugs are covered at 100%. Also covered at 100% for all plans include preferred generic and preferred brand diabetic supplies and insulin. For retail pharmacy drugs, there are no changes to retail pharmacy drug copays. So preferred generic drugs are still $15 copay for the PPO 1500. And for the preferred brand drugs under the PPO 1500, it's a $30 copay, right? These are each for a 1 month supply. And for non-preferred generic and brand name drugs, a $100 copay for a 1 month supply. The PPO 1500 also includes specialty drug coverage, up to $100, it's for $100 copay for a 1-month supply. Now, as I mentioned with mail order, under the PPO, preferred generic drug mail order 90-day supply remains no charge. Preferred brand mail order up to 90-day supply is a $30 copay. Non-preferred generic and non-preferred brand drugs mail order 90-day supply is now $100 copay. So now you can, so what was different is in last year and years past, it's always been $0 for all tiers for mail order drug. This year, you now have a copay for the preferred brand and non-preferred generic and non-preferred brand tiers. The HSA prescription drug benefit, again, I meant, we already covered the ACA preventive drug list, and we covered diabetic supplies and insulin covered at 100%. But for the rest of pharmacy with the HSA, as I mentioned earlier, the deductible applies all the way down. So when you go, whether it's for retail pharmacy drugs or mail order pharmacy drugs, your deductible applies first, and then you'll be responsible for your copay. So with the HSA, with the preferred generic drugs, if you go to a pharmacy for a 30-day supply, that's deductible, then $15. Or if you go to a pharmacy for preferred brand drugs, 30-day supply, that's deductible, then $30 copay. And then non-preferred generic and non-preferred brand drugs are a deductible, then $100 copay. Specialty drugs for a 30-day or 1-month supply is deductible, then $100 copay. The RSP plan is very similar to that of the PPO. You have a $15 copay for preferred generic, you have a $30 copay for preferred brand, and you have a $100 copay for non-preferred generic and non-preferred brand. Mail order, again, is no charge for preferred generic mail order. It's a $15 copay for a 90-day supply of preferred brand drugs and a $100 copay for a 90-day supply mail order for non-preferred generic and non-preferred brand. Each of these drugs also pay 80% for prescription drugs that you have to obtain outside the USA, including Guam and the CNMI. For example, if you are in the Philippines and need to obtain a drug, these would be covered by the plan at 80% and 20% member responsibility. If there are drugs that you are unable to obtain on island, please contact our office at 47 Aetna to help you. There are opportunities for us to have drugs shipped to Guam without you having to travel outside of Guam to obtain those drugs. So please be sure to talk with our team. They're more than readily available to support you with your health journey. Dental. Each of our plans have, you all have access to the dental plan, which provides a $1,000 maximum, no deductible, and for diagnostic and preventive service, 100%, no charge to you. Basic and restorative, such as your fillings, are covered. Plan pays 80%. Major and replacement care services are covered at 50% in network when you visit a participating provider. As you'll notice, when you go out of network to a non-participating provider, the benefit changes. Again, whenever you go out of network to a non-participating provider, whether it's medical or dental, you may be subject to balance billing, and that's the amount that the provider charges above Aetna's allowed amount for a service. Again, we have no contracts with those providers, so we cannot control the amount that they charge. So please be sure to try to stay with a participating provider when you're able. How your plan works. I mentioned Aetna Medicare Direct. Again, a great, easy, simplified system for an easy way for you to sign up and also to manage your Medicare claims. Again, Medicare will process the claim, push it directly to Aetna, and Aetna will process. You'll get your EOB, your explanation of benefit from Medicare, and you will also get your explanation of benefit from Aetna when Aetna is done processing. Aetna is unable to process a claim before Medicare if Medicare is your primary insurer. So sometimes some questions that I will receive is, why hasn't Aetna paid my claim? And the first question I'll ask is Medicare primary? Yes, Medicare is primary. Okay, well, we have to wait for Medicare to process it and then submit it to us. If you're not signed up for Medicare Direct, please contact our office and let us know. We'll get you signed up. If you're not signed up, that does mean that you will have to manually submit your claims from Medicare to Aetna in the meantime. Care outside of Guam and the CNMI do require pre-authorization. If you are in need of a pre-authorization for care outside of Guam and the CNMI, please contact our office for support so you can obtain that authorization. We have many great facilities for you to visit off island in the event that you need to go off island. In the Philippines, to include St. Luke's, Makati Medical City. We also have others throughout Asia Pacific and also those in the U.S. mainland. We have added more facilities to our centers of care, which include not only facilities in Hawaii and California, but also Washington and Oregon. To schedule an appointment, being enrolled is first most important. 2, when you schedule that appointment, confirm that the provider is participating or not participating with Aetna. And you may not have to have a plastic ID card for that appointment scheduling, or when you go to visit that participating provider, oftentimes they may just accept the ID number, or if you are registered on Aetna.com, which I encourage everyone to do, you'll have access to a temporary copy of your ID card on the computer that you can print, or if you download our mobile app, the Aetna mobile app, which appears with a purple background and a white A. The Aetna Health mobile app will allow you to log in and have your ID card readily available on your smartphone. Again, for care outside of Guam, outside of Guam and CNMI, you need a pre-authorization. So please be sure to coordinate your care and your appointments with our team at the Aetna office in the Hulali Center. While unfortunately, due to the PCOR 1 status, our office is closed to the public, please do call us, 47-Aetna. Supporting you. We have, as I mentioned, we have a lot of great resources available to you. If you are able to access Aetna.com to register, please do. That's going to be the best first start to accessing all the great resources. Having the mobile app available to you makes everything also a lot easier. If you're someone like me who doesn't have your wallet on you and an ID card, I can't tell you how many times I've lost my ID card or the kid's ID card. You can just keep ordering them, right? And I'll keep losing them. But I know that I always have my phone on me, no matter where I am. So if I'm out and about and I'm just not feeling well or something happens, I need to receive care, I know that I have it on my phone. All I have to do is open the app and show the provider my ID information. And from the app, you can also email it to the provider. Our well-being incentives. So we have 2 well-being programs available to you to receive rewards. One is our Healthy Rewards Incentive Program, also called Wellbeing Incentive Program. That provides you with a $100 gift card or up to $200 for a family. Those only 18 and older are able to participate because it does require that you access the Aetna.com website to log in and register. And how to complete the Wellbeing Incentive Program, you must complete 2 of 3 items. One item is complete a biometric screening or complete the online well-being assessment, which is like a health risk assessment. And 3, participate in an online health coach journey. If you complete 2 of those 3, you qualify for a $100 gift card. And in a family, you qualify up to 200 if the adults within the plan complete 2 of 3 each. We also have our gym benefits still available to you effective October 1st. And those gyms include CrossFit, CrossFit Hita, CrossFit Lottie, Custom Fitness, Hilton International Sports Center, Paradise Fitness, Dedido and Hagatna, the Gym Guahan, and Urban Fitness. There are no restrictions on participating in the gym benefit. However, to register with a gym benefit, you must register with the gym to complete their application for effective 10/1 and on. Upon completing the gym registration, your gym may send us directly your registration, or they may require that you give they give you a copy to deliver to Aetna. And since our offices are closed, you can deliver a copy of your gym registration via email to govguamservices@aetna.com. Again, that's govguamservices@aetna.com. Upon completing the registration of your gym, you must also complete an Aetna gym form. We are requiring all members who want to participate in the gym benefit to complete this Aetna gym form, which will help us better track which gyms you are enrolled in. So the way that this benefit works is it's for those 18 and older on the plan. And for me and my family, my kids are unable to participate because they're not 18 and older. However, my wife and I are able to participate. My wife and I do not have to go to the same gym. We can go to separate gyms. Maybe she chooses to go to Paradise and I choose to go to CrossFit. And that's okay. We're allowed to do that. The plan accepts that. However, when we register, let's say in this example, I'm going to go to CrossFit, whichever the two available. Let's say I go to CrossFit Lottie. I go to CrossFit. I complete my registration there. I take a copy of my registration. I go to Aetna.com, or the Aetna Gov Guam website, the Aetna Gov Guam website to pull a copy of the Aetna gym form, or maybe CrossFit Lottie has a copy of the Aetna gym form so that I can complete right while I'm there. You must submit to Aetna both a copy of your registration of the gym and the Aetna gym form in order for the benefit to be applied. So please, please, please don't forget that this year we are requiring the Aetna gym form to be completed for access to the gym benefit. My wife would go to Paradise Fitness in this example. She would complete the registration there, and they will provide her, or she will obtain via online or through Aetna, a copy of the Aetna gym form to complete her application and submission of the Aetna gym form to Aetna. The Gym Incentive Program is also available to you, which provides you a $75 gift card. To obtain a $75 gift card, you must have gone to the gym 10 times in 1 month, 3 months in a row. Upon qualifying for the $75 gift card, you must also have completed a well-being assessment, a health risk assessment, available to you online by logging into your Aetna.com account. By having gone to the gym 10 times in 1 month, 3 months in a row, and have completed a health risk assessment, a well-being assessment, you qualify for a $75 gift card. So let's say, for example, you forget to complete the well-being assessment. You've completed the qualifications of attending the gym 10 times in 1 month, 3 months in a row. You would notify Aetna that the accomplishment that you've completed, and Aetna will advise you that Hassan, please complete the well-being assessment available to you online. I don't see that you've completed. You go ahead, complete it, and we will have it documented on our system when you've completed it, and then we'll be sending you your $75 reward. Other great resources include our member service center. Again, we have a great care team that's available to you 24 hours, 24/7 to support you and your family in time of need. So how I use the care team to talk to a nurse, oftentimes it's usually when my kids are sick and I'm looking for ideas or ways to bring down their fever or what to do. Or if someone has a chronic condition and they need help managing that chronic condition, whether it's diabetes or any other chronic illness, you can speak to a nurse by calling the Aetna Member Service Center. And there are other many great ways to utilize that Aetna Member Service Center when you are not home. So let's say you're on travel and something's happening and you need help to find a provider. Please give us a call. We're here to help you. We also have many other great resources, including WISA app, which is a behavioral health app. And this is a great page to look more into and read about, to learn about all the many great mobile applications and online resources to support you and your family, especially during these difficult times. And last again is our Aetna Local Guam office located in the Hulali Center. Again, our office is currently closed due to PCOR 1 status. We do hope to open up soon, but please in the meantime contact us at 47 Aetna, or please visit our website at by Googling Aetna Gov Guam to then see all the many additional resources available to you on our Aetna Gov Guam website. Again, I encourage everyone who is able to register on Aetna.com. Again, there's lots of other great resources available to you there. And I hope that our office will open soon. And I pray that everyone stays safe and stays healthy during these difficult times. Thank you.